So lipedema fat does look a little bit different. It tends to be a little bit whiter than normal fat. It has more of a stringy kind of nodular component to it, and that's because there's inflammation that's occurring to lipedema fat that makes it firmer and harder, and there's lipid nodules that many times occurs, which becomes what we call fibrotic, almost like scar-like nodules. And it's admixed with the normal fat. So when liposuction surgery is being done, I am removing fat. I'm focusing on sculpting that layer very precisely and specifically and bring that whole layer down. You really can't tease out the lipedema fat from the normal fat. You are doing liposuction perfectly and getting the best result both functionally and aesthetically. And in that liposuction fat, there is the lipedema fat also. Some patients are more fibrotic. They have more of a scar-like components to their lipedema fat because they have more inflammation with their lipedema. Usually those patients have more pain and tenderness as part of their symptoms. And it makes it a little bit more particular in terms of doing the surgery itself. This is where I not only like to use the wall, but also use other devices like power-assisted liposuction to emulsify the fibrotic layer, and many times the laser in patients like this too. I find the healing process in those patients is really almost no different than a typical lipedema patient. So fibrotic tissue is tissue that has scar-like components to it, and it's occurring because there is inflammation around the fat, and when you have long-standing inflammation, there is almost like a repair process that occurs there, and you get collagen that's formed, and collagen is what makes scars. So people that have more fibrotic component have more almost like scar-like tissue in their fat. I would say these patients have more tenderness and pain in general. But you really don't know, or at least I don't know until I'm actually in there doing the work itself and doing the sculpting. Many times I'll think a patient might be very fibrotic and I get into that layer of fat and it's very soft and squishy and just comes out beautifully. In other patients, they're more fibrotic. They have a lot of nodules in their fat, a lot of almost like scar-like tissue in their fat. And when I get in there, it's a lot more of loosening that fat layer up and breaking it up. And this is again where I many times will have the laser on standby as I'm doing the case and use it to break up that fibrotic tissue. In those patients, there's also a very important decongestive component to the liposuction itself. The liposuction is not only just removing the fat, but breaking and loosening up that fibrotic tissue that's literally kind of strangulating the vasculature, the lymphatics, and causing more swelling. So there's that component of liposuction that's so important in terms of breaking up fibrotic tissue.